Yeah, absolutely. So we have a wide variety of transducers. Some places that you go have a whole buffet of transducers, I like to say. But this one here, this is what's called a curved transducer, and you can probably kind of guess why, because it has a curved footprint on it. This is what we call a 5 megahertz transducer, so it's got a 5 on the outside there, and that's just the frequency at which it operates. And this is kind of our workhorse. We use this for a lot. You know, we use it for almost all of our abdominal work, our pelvic work, our OBGYN type of exams. It gets used quite a bit. This is what we call a linear transducer, and again, you can probably guess why, because it's straight on top, or it's flat on top, and it's this particular one is a 12 megahertz transducer, so a lot higher frequency. That means it's not going to be able to penetrate as deep in the body, so it's for more superficial structures in the body. We use this a lot for carotid arteries and veins that are close to the skin surface. Thyroid ultrasounds that are, you know, close to the skin surface too. So we use this one quite a bit as well. And then this one here is what we call a phased transducer, and it has to do with how the machine electronically steers the beam, which is kind of a physics concept, kind of beyond my understanding too. But as you can see, it has a really, really small footprint. Okay, so this is what they use for echocardiography, because you're working around ribs, you're working around the sternum. You need to be able to get into those really small spaces to be able to image the heart, and this is the ideal type of transducer for that. And you know, that's just 3 different transducers that we have. They come in all shapes, all sizes, different frequencies depending on whether you need penetration or if you're imaging superficial structures. And that's not even getting into the 3D probes too, which can take those 3D and 4D images, which normally you think of the cute little baby faces, but and that's one of the uses that we have for those, but there's other uses for that as well too. So there's a lot out there, and you know, we're lucky enough to have what we have, but brand new, you know, each one of these is about $10,000 to $20,000. So yeah, and they're delicate, you know, so we don't want to like bounce them off the floor or anything like that too, because they can break pretty easily. That's a good question.
Can you show us like just some basic things on the ultrasound machine and what you use most of?
Okay, so obviously the display screen, so you know that's where we're going to be viewing our images at. Up here where it says patient, that's where I can put in all of my patient information, as much or as little as your institution wants. In most hospitals then, this is going to be hooked up to the RIS and to the DICOM, so it will automatically populate with my patient list, so I just have to select that off of the screen that way. Once I have my patient, I can select which type of transducer I want to use. So depending on what transducers I have hooked up to the machine, I can tell them which one I want to use. So you can see the shape on the screen just changed there. So this is that little phase transducer I was showing you guys. And it is set up. I have other presets on the screen that I can use. This one happens to be set up for adult echocardiography, so I'm going to be using that for the heart. If I put measurements, or if I want to type information into the machine after I do an exam, I can hit this report screen, and then I can edit the report, and I can type anything that I want to into that box. That's what's called a sonographer's technical impression. It's not a diagnosis, because we're not doctors, we don't diagnose, but we can convey important points of our exam that we want to draw to the interpreting physician's attention, so that they can pay particular attention to that then. What else do we have? I have lots, it looks like there's a lot on here, and you know, we just kind of learn one thing at a time. What does this button do, so that it doesn't get too overwhelming? But I have buttons that change the depth of how deep I can penetrate into the body. I have a focus button that kind of shifts where my focus is on the screen. I can zoom in on things if I want to. Okay, I have acquire buttons that let me save different images. I have a freeze button that lets me stop my image and take my pictures and then unfreeze to begin my exam over again. I have a labeling button where I can label whatever I want to on the image so that the interpreting physician knows what structure I'm looking at. If I don't like what's on there, I can pull up a keyboard and I can type any of my own stuff too, which is kind of nice. I have measurement keys where I can measure the size, the shape of different structures as well. And then I mentioned color Doppler earlier. So color Doppler tracks movement, just like Doppler radar. You know, Doppler radar today is tracking storms. My Doppler is tracking blood flow. It's tracking movement of red blood cells within the body. I can also have a setting called pulsed wave sonography, and that's the one that allows me to get an audible signal of the movement of that blood flow. So, you know, you hear on TV shows all the time the whoosh, whoosh, whoosh of the baby's heart rate. And it's not just baby heart rates, it's any kind of blood flow or movement through the movement of blood through the cardiovascular system. I have what's called a gain setting where I can turn up the sound power so I can image structures better, or I can turn it down if I want to make my images a little bit darker. So it looks kind of overwhelming, but there's certain buttons that we use a lot, and then there's certain buttons that we use just to kind of fine tune our images, but they're not used as frequently as some of the other settings on the machine.